I got into nursing initially during high school when I was trying to decide what I wanted to do with my career. I was involved in a national ski patrol with my father. So basically just providing first aid care to people who become injured on the mountain. And I just really liked the medical side of things, but also just the interaction with all the patients that I got to take care of. So then that really solidified. I already thought I wanted to be a nurse, but that really solidified deciding to apply to nursing programs for college. This healthcare crisis has been very demanding and challenging in many ways. The most challenging way is that I'm now 27 weeks pregnant, so it's kind of limited my abilities to be as flexible as I would like to be. I've definitely been doing certain things. The hospital has opened up a COVID hotline that I worked on for multiple shifts, kind of answering calls from people in the community trying to ease their fears and direct them towards either being tested or seeking other medical attention if need be. Other things that I've done is really just taken extra precautions in my own department to be able to still provide care to my patients safely and effectively while protecting myself. But it has been very challenging. A memorable patient experience I have is from a previous position I held at a different hospital. I worked in a cardiac intensive care unit where we mostly took care of patients before and after open heart surgery. And I had an elderly female patient who came in and they found out that she did need to have bypass surgery because she had a blockage in her, it's called your left main coronary artery, which you cannot live with such a severe blockage. So I spent many hours with her children and her husband and her going over the procedure and everything. And then I left and she had to go to surgery. And the main part that I remember that touched me was that when I came back to work, it was a few shifts later, and I looked to try and find her, and I couldn't. And I was told by my charge nurse that she had passed away due to complications after the surgery. And then I got a call from the secretary saying somebody was there to see me, and I went up to the waiting room, and it was her son. And he actually made it a point to come back. And on the next day, I was working and talked to me specifically about how it meant a lot to them that I spent so much time easing their fears and that they were really thankful, so it really touched me.